Hello, dear students. Once again, welcome to my continuation lecture number 2 about the applied nutrition and dietetics. So, I'm Dr. Zahur Islam, and you are watching me on my YouTube channel, Zahur Islam Official. So, I'm going to record another clip on my students. So, today we will talk about the congestive heart failure. So, what is congestive heart failure? So, what actually happened there? So, congestive heart failure as something you can say it is occur due to decomposition, decompensation, or severe injury to the heart muscles. Mean the heart muscles that become injured. So, and congestive heart failures. Yeah, I mean that the actually there is occur congestions at the level of heart. Mean the heart is not able to receive the sufficient quantity of the blood, which is the normally the demand of your body, so it doesn't fulfill it. So in congestive heart failure there is occur decrease the circulation, which is caused or decrease the oxygenation of the body. Simple, whenever there is inadequate supply of blood to some particular area of the body, especially to the heart, so ultimately there will be poor blood circulation along with the oxygen. So when the oxygen supply is poor, then ultimate, so as well as the oxygen supply well must be poor over there. So there will be these are the different signs symptoms reported. For example, if someone is suffering from congestive CHF, congestive heart failure, these are the signs symptoms which is reported by the literature. There will be shortness of breath, there will be a chest pain on the exertion, and edema, and these are very common sign symptoms which are reported by the literature. So, and congestive heart failures, what is happens especially in congestive heart failure. There is a decreased nutrients to the body tissue. Mean the body tissues, they are unable to receive the certain nutrients in the form of micronutrients, or they may be in the form of macronutrients, so it doesn't received by the body tissues. So definitely when there is insufficient nutrients reach to the body tissue, these tissues or cells become weak and weak, and it become degenerate, or it become weak, or it become die. So edema may mask the problem of malnutrition and underweight. This is also one of the big issue nowadays, especially not only in Pakistan, even in all over the world. So you need a proper balanced diet. You will have to maintain your balanced diet. I mean that for your body there is a need of macronutrients as well as micronutrients in order to maintain the dietary recommended allowance. For example, you need certain amount of carbohydrates. You need some uh, a minute amount of proteins, as well as fats, micronutrients, macronutrients. So all these are the essential nutrients, which is the need of your body. So if these nutrients they are inadequately, or for example, if you are taking these nutrients in low quantity or in high quantity, so both of them, these are the risk factor. So in case of a lack of sufficient nutrition, so definitely there will be chances of malnutrition and underweight. So more and more complications will be occur. So the heartbeats had become faster and enlarges. So these are the different conditions which is associated with mm, congestive heart failures. Okay, so let's now come toward the dietary plan or dietary management for the congestive heart failure. That, for example, if a patient or someone have a congestive heart failure and the diet, so what will be the strategy that how we can control or how we can prevent the congestive heart failure with the help of dietary supplements. So first of all, there should be a fluid restriction. It may be ordered. So mean the fluid restrictions mean there is no need to restrict some fluids because you need fluids. Um, which is the physiological need at maybe order because these fluids can maintain your electrolyte balance. Sub foods should be given to the patient, and there should be small and frequent meals mean for the patient, not like on a regular basis. Okay, so the diuretics, especially, and the sodium restricted diet, they are typically prescribed. So in congestive heart failure, uh, so I think it's our social and ethical responsibility to provide certain medications and the form of diuretics and the form of diuretics which can increase the urine frequency and more salt and sodium and certain electrolytes they will be released from mean they will be excreted in the form of urine and sodium restricted right, they are typically prescribed to the patient. When diuretics they are given to the patient, so it can cause excessive loss of potassium. Mean and blood levels should be monitored. This is very important. So you will have to monitor the mean, the hematocrit or the blood level should be maintained. Hypokalemia may be occur potassium. Let's suppose if the potassium depletion occur, low level of potassium. So hypokalemia can upset the heartbeat. So you need some fruits, you need especially the orange. You need banana and cuts. They are excellent source of potassium. The supplements must be given to the patient. There are some fruits which contain abundant quantity of potassium. So that is fruits, that is apricot, and that is orange, that is bananas, that is avocados, and cantaloupe, dates, pigs, raisins, grapes, fruit, kiwi fruit, peaches, pineapple, prunes, and strawberry. So these are the fruits. These are the high potassium food, the food which contain a rich amount of potassium. So, for example, there are so many examples which you can see on my screen. That is apricot, that is orange, banana. So actually, these kind of food contain enough quantity of potassium. And vegetables like broccoli, cabbage, green beans, pumpkin, squash, tomatoes, spinach, potatoes, and sweet potatoes. These are the it come under the category of vegetables. So inshallah, in my next lecture, we will talk about what are the different dietary plan which is required, which is needed for the heart disease. So thank you so much for watching my lecture. So if you need these contents in soft form, so you can email me. So I'm always available for any kind of services. Thank you.